Hi everyone, I'm Dr. Roman and I'm a hematologist oncologist, and I recently made a video titled Pancreatic Cysts and IPMNs, or IPMNs and Pancreatic Cysts, and I went back because I've gotten some responses as far as my Branch Duct IPMN number that I quoted, the risk of cancer or them turning into cancer, and I've realized that it's causing quite some stress. So I went back, I looked at that part, and I can see where a lot of the stress is coming from. And after rethinking things, I think I could have definitely worded things a lot better. And I actually made another video, which if you were looking for that one, I canceled it, I deleted it, because I figured I'd make this final video, and hopefully after rethinking things, hopefully I can put you to some rest. So the bottom line is, listen, when it comes to branch duct IPMNs and the cancer risk, there is no number I can give you. Nobody can give you a number. If somebody tells you it's 1% versus 30%, they are wrong, because we do not know. We can say that branch duct IPMNs have a much lower incidence of cancer or turning cancerous than main duct or mixed type. Period. That's all that we can say. So, a lot goes into this. Your own personal case, your genetics, were you a drinker, were you a smoker, your family history, what type of an IPMN tissue type do you have? Is it gastric versus intestinal versus pancreatobiliary? There's a lot that goes into this. Every single case is different, so that's as much as we can say. Also, a lot of the higher numbers come from surgical series. It would be expected that if a patient with a branch duct IPMN went to surgery, it's because they had worrisome features or high-risk stigmata or high-risk features, and it would not be it's not surprising to see that these patients have a higher rate of cancer than patients that do not. We do know that if you have a simple appearing cyst with no intermediate or high-risk features, your risk of cancer is extremely low. So a lot of those tiny numbers that you're looking at out there, it's from data from patients that have low-risk features, like absolutely nothing that's intermediate or high-grade. They go to surgery, and the grand majority of these patients do not have cancer. I think that's where these tiny cancer risk number comes from, because if you look at patients that do have intermediate or high risk features, it's not tiny anymore. The number does go up. I'm not going to quote numbers. I've already been down that path. So I just want to say the reason I quoted the higher numbers were the 20-30% that I was quoting that I have no data for. It's just me trying to put all this data together, is basically because we know that a lot of you out there, as I said in the past video, who think you have an IPMN do not have an IPMN. Some of you may have a pseudocyst, a simple cyst, and they're calling them IPMN. So when you clump this up with the IPMN, it does tilt the data to the left, meaning that it makes these patients that are never going to develop cancer, but yet they didn't have an IPMN to begin with. So it's my opinion that that's why some of these numbers also might seem lower than what they might be. Again, might be. Also, as I've stated before, I see pancreatic cancer patients, okay? And I can tell you that patients who have unresectable pancreatic cancer have a biopsy. It just shows pancreatic adenocarcinoma. We never find out if this patient had an underlying IPMN. So when they go back and they look at these large retrospective case series or reviews, they don't know if these pancreatic cancer patients had an underlying IPMN and are never added into the data as far as the risk of pancreatic cancer. Also, we are also resecting intermediate or patients who have intermediate grade risk factors or high risk factors. So we're not letting these patients become pancreatic cancer, rightfully so. That's the whole goal here. So, in my original video, the IPMN and pancreatic cyst video, I said that, if you're younger, the risk might be higher. What I was trying to say is that it just makes sense. If you're younger and you're going to live 30, 40, 50 years, then you would expect the number to be a little bit higher, because you're just going to be around longer than, say, an 80-year-old patient who was recently diagnosed, who's expected to live maybe 5, 10 years. I'm just giving you common sense facts. So with that being said, your risk of developing pancreatic cancer or your branch duct IPMN turning to pancreatic cancer, we do not know. All right, we do not know. The data is all over the place. All I can say, or all we should say, is that most with a branch duct IPMN do not develop cancer, period. Now, I do want to make sure that you are continuously followed. Make sure you follow, because I have seen patients whom tell me, oh, my risk is tiny. My doctor told me tiny. I don't know where they get this tiny from, because we can't say that either. And then they're lost to follow-up. They don't come, they don't have their scans, and I think that's a big mistake. So I don't want to talk about this subject anymore. I have to tell you, I even lost some sleep last night thinking that I may be hurting somebody, and that's the last thing I want to do. I really want to help you out. Guys, I'm a patient too. So, and I also want to say that maybe some of these, some of my numbers also have to do with the fact that I am also a patient. This also bothers me. I live with this. I'm also paranoid at times. So, maybe so in other words, I'm biased. So this may have gotten the best of me. Okay, so thank you for your attention, and I'll catch you on the next video.